And now on the line is research scientist and associate professor at UCD, David O'Connell. Welcome to the programme, David.
Good morning, Darren. Thanks very much for having me.
Okay, David, I read an article in the Irish Independent about your work over a week ago, and I also listened to the interview you did with Ray Darcy on RT Radio 1 around the same time. The work that you did, that you described in those interviews, is fantastic, I believe, and is the reason I got in touch with you to do this interview today on Near FM. Before you tell our listeners on Near FM, for those who don't know, about your recently published work, could you start off with telling me, David, a bit about your background in general and the professional work that you do?
Thanks, Aaron. Yeah, I'm an employee of UCD. I'm a professor here in the School of Biomolecular and Biomedical Science. And what that means in plain terms is that I teach biochemistry and pharmacology, amongst other things, to undergraduate students, second years, third years, fourth years. And I also run master's programs here in biotherapeutics. And what they mean is that these are protein-based medicines. And I guess many of your listeners would know what these are, because insulin, for example, for the treatment of diabetes, is a protein-based medicine. And many drugs that are taken for things like cancer treatment or rheumatoid arthritis treatment would be antibody-based medicines as well. So again, I think many people in Ireland are familiar with the fact that we have a huge foreign direct investment from big companies that make a lot of these drugs for the worldwide market here in Ireland. One example, just to give you, is in Swords, County Dublin. We have a huge plant, MSD, and they make an antibody medicine called pembrolizumab for cancer treatment. So my job is to teach the basic science to undergraduate students, and then teach applied applications of that science to master's students. My own background was originally, I did my degree in UCC in Cork, and then I went up here to Dublin, did my PhD at UCD in the early 90s, and then I went across to California and spent some really happy years in San Francisco at the University of California, San Francisco, doing my postdoctoral training there. So now it's all come together, working here in Belfield, in UCD, and I have a lab that develops new protein molecules. But importantly, and this is an important point to make, I also work with top labs in Cambridge in the UK, and also in Lund University in Sweden, which is just above Denmark there. And I have some fantastic collaborations with scientists there.
Okay, that's cool, yeah. Okay, we're going to talk today about some research that you did about dementia. Okay, I'm probably not going to understand what you have to say on this, but before we talk about the implications of your research about dementia, could you tell me how biologically you came to your results? That is, if the work is not top secret?
No, not top secret. Thankfully, the reason I guess we're being talked about at the moment is that we published our results in a top American journal called Proceedings of the National Academy of Sciences, USA. So this is a journal I've always wanted to publish, important research in. And together with my colleague Sara Linsa in Sweden, we invented a new way of making protein-based drugs. So there's two kind of key things to know. One is we invented two new big pots of drug-like molecules that are protein in nature. And these are proteins that we designed. So we basically sat together and figured out what we think would be an ideal kind of protein shape. And then we got those pots of drug-like molecules made. And so there's maybe over 2 billion different protein molecules in there. And then we decided to go after a key target in the steps of toxicity in the brains of dementia patients. So in Alzheimer's disease, as people get older who suffer from Alzheimer's, there are changes taking place in their brain cells. And I'll keep it simple. One of the major changes is where some proteins begin to stick together. And when they start sticking together, this starts causing problems for the cell. The cell starts to die. So we have managed to pull out a new drug from our new libraries, our new pots, that actually very specifically binds to and stops the sticking together. And what this means is that it has the potential to halt the symptoms of the progression of symptoms in dementia, Alzheimer's.
That's fantastic, yeah. And am I right in saying that you can be fairly confident that your work is going to lead to a new treatment or treatments for dementia and Alzheimer's?
We're very confident that we've made the perfect start, that we've got the right drug candidates, and we also are currently two things. We have a very good team around making those drugs ready for clinical trials, and we're also building a very good team around us to get the money together to bring those clinical trials forwards quickly. So I think the number one question I've been asked by, let's say, ordinary people who, like ourselves, who experienced dementia in our family, their question is, how soon, and can my father or can my mother, my husband or my wife take part in a trial? So the main thing to say to people is that we have come up with something extremely valuable, which we believe will go into clinical trials, and that we believe, can be brought to clinical trials sooner rather than later.
When you're saying that you're confident that it is going to be brought out in a few years as a drug, would there be much chance, do you think, that, I know you're saying it could very well stop the progression of dementia, do you think is there any chance you think that it could be able to reverse it?
It's a great question. It is the key question as well. I suppose there are different levels of ambition when it comes to developing a medicine to treat Alzheimer's. The first ambition is to slow down, to delay the progress of symptoms. So if you've got a relative who, has already started showing clear signs, the number one objective there is to slow them down so that the person doesn't deteriorate as rapidly as they can do. So that's the first ambition. Could these types of treatments end up reversing the condition? That will only be, the only honest answer to that would be you'd have to wait till we start getting trial data back, because the main thing is to treat those patients, to see a delay, and then to study those patients to see, is there a reversal of their decline? So naturally, the ambition would be to come up with a medicine that can do that, but the first priority is to come up with one that stops the disease from progressing.
And do you think if your work becomes a drug or drugs, that do you think it'll at least stop the illness, or it'll slow it down, or what do you think?
Well, as I say, my hope is that if it could slow it down, what you might now get is a scenario where you have a person with mild symptoms. So very often we have people who are transitioning from, let's say, some sort of state of confusion to much more debilitating symptoms. So if we could treat somebody who is, showing mild cognitive impairment, some confusion, for example, if you can treat them then with something that slows the disease down significantly, they may not progress to significant symptoms past that point. That would already be a huge victory for many families. It might mean that that person would not have to go into long-term care, for example. The future of the area, though, what you're asking is still a good question, because I don't want to come on air and sound like we've suddenly come up with the magic bullet. But what is known about the disease pathology is that if we had a suitable diagnostic, a blood-borne diagnostic, which we don't have at the moment, that could tell us that this person is likely to be ill with the disease in 10 years' time, or maybe because of family history, that they could potentially be taking prophylactic medicine, i.e. they could be taking medicine without any symptoms, with a view to halting the progress of symptoms that can't be seen.
Okay, that's cool, yeah. Okay, I won't keep you much longer, Dave. I know you're a busy man. I understand that only in the last year or two, the US FDA authorized a new drug for dementia, but I believe that that whole situation with that particular drug has gone badly wrong since then. Could you tell our listeners today on Near FM, David, a bit about the evolution of drugs to treat Alzheimer's and dementia? That is, if there has been much evolution up until recently?
Yeah, that's a good question as well. Well, over the last 20 years, 20, 30 years, there's been a big effort to try to develop an antibody-based medicine. So antibodies are used to treat cancer quite effectively. They're used to treat inflammatory diseases like arthritis quite effectively. But getting an antibody across into the brain is not easy. The antibodies that have been developed have almost all failed in clinical trials, either because they're not getting into the right place or they're not targeting the right molecule to stop the symptoms. The most recent approval, aducanumab, it was approved by the FDA. This caused a lot of controversy because there was an internal debate in the FDA as to whether it should be approved, and there's no real significant evidence that it's making a big difference in patients. So this is still a frontier in medicine where developing a drug that can modify the disease, i.e. stop it or slow it down, remains a grail for many companies. The big problem is with all of these failures, it has dented confidence significantly, so there's not enough investment in it. And that's why, the development we're talking about has potential to generate some new excitement.
Okay, Dave, it's come towards the end of the interview. I think I heard you say on Ray Darcy's program last week that you're thinking, I think you bought out your research in the last couple of weeks, I believe. Am I right in saying, I think you mentioned the year, 6 years it could take before it becomes translated into drug or drugs? Is that what you think the time frame would be?
Yeah, well, we're working on it right now. We're as well as the advances we're making in the lab, you need some commercial support, you need some investment, so we're working on that too. But yeah, I think that's a pretty realistic target.